Welcome to the Sim Lab. I'm just going to give you a little tour and talk about what we're going to do this morning first. This is our client area. You'll see that we have our little baby in the crib. Okay, you're going to treat her like a real live baby. So if you would normally do an assessment of the lungs, you're going to use the stethoscope, actually open her shirt and do an assessment. You can see on her that she has G-tube, she has the ability to breathe, she can make noises, you can feel a pulse on her arm, you can take a blood pressure on this arm. She also does turn cyanotic, so you'll see a little blue light come on occasionally if she's having difficulties breathing. Okay? On the side over here, she has some equipment, and this is her monitor. So when we start a scenario, it'll give you some patient information, and then it will display, when you put the pulse ox on, it will display the heart rate and the pulse ox just like you would get in the home. Okay? Certain things that the mannequin does not give you is temperature. So if you do take a temperature and you want to know what it is, there's a little piece of paper over here. At that time, I'll remind you to remove it so that it'll tell you what the temperature is, or I will give it to you verbally. Any of that information, like suctioning, things like that, that the mannequin can't do for you. Okay? On the side over here are all of her equipment. We tried to label them and have it set up like we would in the home, so that this way, if you're going to do nebulizers, you'd open the drawer and get out that nebulizer. If you're going to do G-tube care, you'll know where to find that. So we have everything set up here, including oxygen on the side. Around the back, just so that you know, that's where we have the extra equipment that you don't need for this time, for this scenario. But I may be in between scenarios pulling out different equipment. Okay? We walk around the back here, so you wonder what's going on behind the big curtain. This is where I'll be sitting. And as you noticed, when you look around the room, there's cameras in the room. So as I'm sitting back here, I'm watching you on the camera. And I'll be watching what you're doing with the mannequin. And while you're doing things on the mannequin, I will be looking at this screen and I will be checking off the items that I expect you to do. As I check them off, they pop up on the screen over here. Oops. As I check them off, they pop up over here, so that I know that they were done and they're all time stamped. So then when we're all complete, we'll sit down and talk about what happened during your scenario, and that's called the debriefing portion. We'll talk about how you think things went, and there is a list of what happened during your scenario that we'll review as well as print out for your file. It shows us at any given point what was happening at that time, so that we can review if you didn't remember or if we had a question on technique. Okay?